Thank you and good morning. And my name is Barbara Keeley MP, and I'm here to welcome you to this meeting of the All-Party Group on Coronavirus. Today we're going to hear evidence on the COVID-19 public inquiry, a very, very important inquiry after such a horrendous pandemic. So let me introduce our first panel and welcome them for joining us today and thank them for joining us today. Our first panel will be Rabinda Sherwood from the Bereaved Families for Justice. I'm really sorry that Rabinda lost both her parents to COVID in January 2021, and she became a member of the UK organisation called COVID-19 Bereaved Families for Justice in April 2021. Thank you, Rabinda, for joining us. And Professor Stephen Riker is on our first panel. Stephen is a Professor of Psychology at the University of St Andrews. We've seen him very much both on this committee and in many media appearances. He's a participant in SPI-B, part of the SAGE group, and in the advisory group to the Scottish Chief Medical Officer on COVID-19. And from NHS providers, we've got Miriam Deakin. Miriam is Director of Policy and Strategy for NHS providers. Rabinda, today's about the COVID-19 public inquiry. Could we start just by asking you to give us some initial comments and just to tell us about your group and how you got started?
Hi there, good morning all. Thank you for inviting me to speak today. So the COVID-19 Bereaved Families for Justice group, for which I am a member of, are campaigning for an inquiry to be started as soon as possible. And indeed, we have been since the very first wave. This is to avoid any further unnecessary losses that we continue to see, and even to date are continuing to see. The cases are rising. It's now, it's never been any more important for the inquiry to be started and lessons to be learned.
Thank you. Well, as we know, as we'll be discussing, Boris Johnson has announced a public inquiry into the handling of COVID-19 pandemic. And in December, the chair of that public inquiry was announced. Let me come to the panel and ask you first then, in your view, should the inquiry process have started sooner? Rabinda.
Okay, thank you. So yes, I do believe it should have started sooner. We should have had a rapid review phase in order to learn those lessons, which we could have believed could have reduced deaths. It should have started significantly earlier. We don't understand that there's no legitimate reason for the long delay between announcing the inquiry and the appointing of the chair. When indeed the group did ask the Prime Minister as to why the inquiry could not be started earlier, he cited reasons about frontline workers being unavailable. However, their input may not have been needed until much later. And this was also at odds with this being said at the same time as the government was effectively declaring the pandemic over through its other actions, such as removing public health protections. The inquiry still hasn't formally started. It means that evidence is at risk of being lost or disposed of. The Prime Minister must establish the inquiry formally as soon as possible, which means as soon as the terms of reference have been agreed upon.
Okay, thank you, Rabinda. Could I ask Stephen Riker, what's your view on the timing? Should it have been sooner? And you're muted, Stephen, I think.
Well, I had a very brief answer, which was yes, it should have. I think that if we had learnt the lessons of what went wrong 2 years ago, and remember it is now 2 years since things started, then I would hope we would be doing things differently and that people wouldn't still be dying and being infected and being harmed in the long term right now because of the increasing evidence that infections do matter. My remit is very much in the behavioral science area in terms of communication, and the communication that is going on right now is that it doesn't matter. It's just a cold, it's all over. And all of those things are leading to considerable damage in terms of deaths and long-term morbidity. And they mean that things will go on for longer. So we should have been having the inquiry by now in order to learn the lessons, in order to mitigate the harms which are happening now and will be happening in the future.
Thanks, Stephen. Miriam?
Thank you. Well, thanks everyone for the chance to contribute. We can completely relate to the argument that the inquiry should have started sooner, and I tend to agree with Rabinder that I don't think operational pressures were necessarily a barrier. So I agree with that. I think our focus at the moment, as Stephen alluded to, is mainly on welcoming the fact that the draft terms of reference are out and supporting the inquiry to work efficiently. And we're particularly interested, as Stephen alluded to, in the learning from the inquiry. So, keen that there are interim reports published and that we're not waiting too long for some of the findings so that we can act on them.
Okay. Thank you all for that. And a second sort of introductory question is really about the terms of reference consultation. So were you consulted, and if you were consulted, what did you think of the consultation process? Can I come back to you, Ravinder?
Yes, hi. I did contribute to the terms of reference consultation, both in terms of sending my feedback and attending one of the consultation meetings as a member. I thought Baroness Hallett, the chair, helped to put people at ease. I certainly found it very easy to be open and honest with what I wanted to say. The summary of my terms of reference feedback, alongside agreeing with main other topics, was public messaging. I think this is very key around this being a Freedom Day with absolutely no thought given to those who had lost loved ones and their families, and indeed people with long COVID. There was no Freedom Day for these people. I also highlighted the lack of analysis and proactive management for the BAME group. Scientists consistently shared that BAME were vulnerable, but we never saw any associated steps by the government on how to minimise the effects to the BAME group, or indeed what they should and shouldn't be doing. My parents, who I lost in January 21, were ethnic background, were Indian, so we're in that BAME category, with my dad being partially sighted and had dementia for 4 years, so extremely vulnerable. Yet there appeared to be no government health advice or guidelines available for either of my parents or anyone else in their position. An important reminder is that without the group, the inquiry team would have had no way of connecting with bereaved families, which in my opinion would not have made the consultation as effective as it was.
Thank you. Thanks, Rabinder. Stephen? On the terms of reference, yeah.
Yeah, so a couple of points. I mean, first of all, I didn't personally participate, but I am a member of Independent Sage, and Independent Sage made an input, and all of the members were involved in the discussion about what that input should be. So yes, we made input. We wait to see what the impact of that input will be. Two general points I would make. First of all, and this is again more personal, as a behavioral scientist, I'm particularly concerned that the behavioral dimensions should take equal center stage. When it comes to the errors that were made, I think in many ways the behavioral errors were as egregious as, for instance, the failures in testing, the failures in PPE, and so on. For instance, the squandering of the extremely high levels of trust there were at the beginning of the pandemic is extremely important. The assumptions made about public behavior, which led us to delay the lockdown, and according to some people could have led to as many as 35,000 additional deaths, are really important. And although it's a small point, I think it's symbolic that the terms of reference still refer to NPIs, non-pharmaceutical interventions, as if the default is the pharmaceutical and everything else comes afterwards. It's a little bit like talking about non-white people, as if white people are the point of reference. Again, the presupposition is the pharmaceutical is the point of reference and the behavioral is secondary. In fact, the World Health Organization has dropped the term NPIs and now talks about public health and social measures. And I think that's a symbolic step we need to take here too, in order to make the point that the behavioral is absolutely central. The other point I would make is it seems to me that we do need to look broadly at the conditions which led not only to the public health harms, but to the other harms that occurred during the pandemic. And I'm not sure that things are drawn wide enough. I mean, I sometimes argue that the pandemic is a little bit like a barium meal, which has revealed the rotten state of our body politic in a number of dimensions. I mean, Rabinda has already talked about ethnicity, and this was, of course, a pandemic of inequalities, and the way in which inequalities contributed to the pandemic through such things, for instance, as crowded housing and so on. We need to address that. Secondly, in terms of the mental health costs, isolation was absolutely critical, and issues of isolation and an increasing isolation of large numbers of people in our society. And linked to that, issues of connectivity. We saw, for instance, that the harms in terms of education were far, far greater to those who were not connected through Wi-Fi, who didn't have devices through which they could connect. And again, that raises questions about participation in society. And the final point I would make is about mental health. I mean, as a psychologist, that's not surprising. I mean, I have been an academic psychologist for 40 years. My wife is a clinical psychologist. And over those 40 years, almost every Tuesday, it seems, somebody says we've got to take mental health more seriously, and nothing happens until the next Tuesday when it's repeated. And I think really, when we talk about learning how to embed issues of mental health, not only in the NHS, which of course is central, but in all our institutions, in workplaces, in schools, in universities, and so on, is absolutely central. So as I say, I hope we can draw the terms of reference more widely to understand those other aspects of our society which have allowed such harms to grow to such catastrophic levels in this country.
Thank you, Stephen. And Miriam, if you can help contribute on that one.
Yeah, thank you. So we did respond to the consultation, and we've also written to Baroness Hallett to offer our services as a membership organisation. So if I can just summarise 2 or 3 points that we made in our consultation response. Firstly, it's really important to us that the inquiry understands the context within which the NHS and social care actually were operating at the point that the pandemic hit, because we think that's a really important lens through which to see both the achievements that were made during the pandemic, but also the difficulties that we faced. So from our perspective, by 2020, the NHS had just been through a decade of austerity, really, with revenue investment way below the long run average for the NHS. So I think that was significant as we went into the pandemic in terms of having already created a bit of a mismatch between demand for care and the capacity to respond. Similarly, in addition to revenue, we'd experienced a number of years of underinvestment in capital. And actually, the different estates that trusts were coping with as the pandemic hit, the nature of IT and infrastructure was a factor, I think, in how some were able to respond. Some had more flexibility, I think, than others. As you all know, we're looking at significant staff vacancies across the NHS now. And of course, we went into the pandemic with high vacancy rates also. So at this point, we're now even more reliant on that discretionary effort from a smaller group of staff than we would ideally like. And final kind of point around context is, of course, social care. So we went into the pandemic arguably with our social care system in quite a fragile state and in need of reform, which is a long-term issue I know you're all aware of. So something that's really important for us, I think, that the inquiry gets its head around and really invests some time in understanding the context for the NHS and the care system as the pandemic hit. Similarly to colleagues, we think it's a really valuable opportunity to understand and to learn from how prepared we were for the pandemic, and perhaps to get underneath whether we were sufficiently well prepared for this SARS type pandemic rather than something that was more flu-based. They're responsibilities which predominantly sit at a national level and then flow through to the local, but we think it's a huge opportunity for learning around preparedness. That's really key. although the terms of reference are relatively broad, we have suggested the inquiry team consider broadening them out to understand the contribution of and the impact on a broader set of NHS and care services. The terms of reference at the moment are quite hospital focused, which is really important, but there was a contribution made and an impact on mental health services, the community sector, arguably a broader set of social care services that are included at the moment, and certainly primary care, 111, our ambulance service, etc. So we've suggested the inquiry team sort of looks across the breadth of health and care services there. We're really reassured to see the impact on the experiences of bereaved families and individual staff members within the inquiry, and similarly the really clear focus on the disproportionate impact on particular groups in society and the inequalities which have been exacerbated by the pandemic. So we're reassured to see that and hope that that's a really clear focus of learning. And lastly, as I said earlier, we're keen to hear from the inquiry at regular points. We hope that interim findings are published, and we're interested to see if there's some kind of mechanism by which decision makers can be held to account for decisions made during the pandemic and be held to account for responding to the recommendations made by the inquiry.
Thank you. I think we'll come on to that in more detail, but let me come to Susan. Baroness Masham, could you ask your question now? You're muted. You're on mute.
I'm unmuted now. I do agree with the previous speakers. It's so important for this report to get underway. It should have been started a long time ago. One of the key concerns regarding the inquiry is that it may take many years to publish findings. Do you think there should be interim reports and findings? It's so easy to lose things on the way. Could we have, first of all, Ivrinda?
I think you're saying Ravinda, yeah. Ravinda?
Fine, thank you. So my understanding from Baroness Hallett is that the intention was to share interim reports. That was certainly what was said at the consultation meetings, which we completely welcome. We believe the primary purpose of the inquiry is to learn those lessons, to stop avoiding the same mistakes and the unnecessary loss of life. And given the ongoing nature of the pandemic, it remains just as crucial. The scale of the inquiry and the potential for further pandemics, new waves and variants, we believe that a staggered approach with interim reports on the most urgent issues is the most sensible approach. This would also appear to be in line with other similar inquiries, such as Grenfell and Manchester Arena.
Thank you very much indeed. Do you think long COVID should be taken into consideration in the report?
Yes, and I do believe it is a terms of reference area that we have included, and it has to be considered. I think I referred to it earlier, that in government messaging about moving on, pandemic over, Freedom Day, that is not the case for those people who have lost loved ones and indeed who continue to live with the effects of COVID in the shape of long COVID. So yes, absolutely agree.
Thank you very much. Could we now have Professor Stephen?
Yeah, I mean, again, I very much agree with those comments. And I think, I mean, we know at the moment, and it's an issue around COVID specifically, but it's an issue more generally, that we are seeing really very worrying declines in public trust in government, in politics, in democracy more generally. And a sense that things are actually going to happen out of this is really critical. I mean, if there are years and years and years where nothing happens, I think it will further erode confidence and trust. So I think a sense of momentum and a sense of things being done, and not only interim reports, but interim action, I think, is important by government. The other thing I think is absolutely critical is this is part and parcel of a broader issue of transparency. There needs to be transparency at every single level in terms of the evidence which is submitted, in terms of the sessions themselves, in terms of the output. This has got to be seen as something which is going to be consequential and is going to make a difference. And people have got to get an increasing sense that our systems are working in such a way that they do make a very real and concrete and timely difference to people's lives.
You know, with the horrific and terrible situation in Ukraine, COVID seems to have gone off the world agenda at the moment. Do you think it should be kept on?
Well, I mean, first of all, of course, actually, one of the questions which I think we'll need to address at some point is the interrelationship between the war into Ukraine and COVID. So the Ukraine, for instance, had relatively low levels of vaccination. We've seen tragically large numbers of people crowded together in basements, on trains and so on, and they are moving throughout Europe. So clearly, I think the war in Ukraine will have an impact on COVID. It always seems to me remarkably, I mean, I think it's wrong to say the pandemic is over here. We have still 3 million people infected in a week. We are learning more and more about the impact of long COVID in terms of its cognitive consequences, in terms of organ damage. It's a serious multi-system disease. But when we look globally, remember that no more than 16% of people, 1 in 6 people in the poor countries has actually been vaccinated. So on a global level, the notion that this is all over is a ridiculous notion, and to posit it, as I say, is remarkably parochial. So yes, the global action is absolutely critical. The slogan early on is "No one's safe until everybody's safe," and we're beginning to forget those very basic and very important lessons. And so it does mean that we still also have to have on the agenda the issue of global vaccination, of donation of vaccines, of the waiver of vaccine patents and so on. And that's still not happening. And I find that quite remarkable.
Well, my daughter has just had COVID and her husband, and that's after 3 vaccinations. And she's still feeling exhausted after 2 weeks. So thank you very much. And we now have Miriam, please.
Yeah, thank you. Completely agree with other contributors. We're fully in support of interim recommendations and also interim action. So it seems really important that the recommendations of this inquiry are taken seriously, and that we look at how to resource and implement them and hold people to account once they're made as well. I would say that the need to learn almost in real time from the inquiry is probably the strongest message of feedback we've heard from trust chairs and chief executives.
Thank you. Thank you very much indeed. Yeah, there's so much to do, and so many things can get lost if they're not done at the time. So thank you. We now go back to the chair.
Thank you. Thanks, Susan. Can I come now to Paul, who's going to ask some questions? Paul.
Thank you, Chair. Good morning. Good morning, panel. My first question is about whether the behaviour of ministers and officials, or more precisely the misbehaviour of ministers and officials, I'm thinking of Barnard Castle and Partygate, should be a matter for the inquiry, and particularly for Stephen, how that misbehaviour may or may not have affected the behaviour of the public. So I'll start with Stephen, if I may, please.
Well, there is absolutely no doubt that starting with Barnard Castle, the sense of one law for them and another for us undermined trust. So a study that was done showed that trust levels fell catastrophically in England in the weeks following Barnard Castle, not in Wales and not in Scotland. It was specific to England, suggesting that it was very directly related to what actually happened. Now, that's the bad news. The good news is that actually, although people lost trust, some people continued to adhere, some people even more, because they wanted to do it despite the government, to say we're not like that, that they may not act in the interest of the community, but we do. So the relationship between loss of trust and adherence is complex, but overall, to lose trust is not a good thing. And to have a government which is not trusted and loses influence in the midst of a national crisis is clearly not something desirable. But I would put the issues of Barnard Castle and Partygate in a wider context. I think we need a wider focus on that issue of trust and the relationship between government and the public, because I think that it was undermined in a series of ways, some of them more subtle, not just to do with Partygate. So, for instance, I think that the approach which blamed the public for non-adherence was counterproductive, both because it alienated people and actually it inflated what were relatively rare examples of non-compliance and made them look like a norm. So I do think that the wider question of trust, and when we ask that wider question of trust, we've got to ask, first of all, trust between government and public, but also trust amongst people in the public, because there is by now a large body of research which makes the point that people adhered not so much for themselves as individuals. In fact, for many people who were healthy, they had a sense of, it doesn't matter that much to me. It was that sense of community and acting for the good of the whole community, which was absolutely critical. And again, once you start with a narrative of blame, saying the problem is that your neighbours aren't doing the right thing, you undermine that sense of community. So as I say, trust, community, I think, is a central element of the behavioural science dimension. And while we do tend to focus and obsess about Barnard Castle and Partygate, important as they are, they're only one part of that larger picture, which should be the focus of investigation.
Are you saying that those behaviours by ministers and officials didn't have a significant effect on the behaviour of the public?
No, I'm not saying they didn't have an effect. I'm saying that the effect was complex and different on different people. But I'm also saying it was only one aspect of the ways in which government behaviours impacted on the behaviour of the public. So the loss of trust went wider than Partygate. So what I'm saying is, yes, Partygate and yes, Barnard Castle should be part of it. But if we focus exclusively on them, we miss other aspects of the picture, which I think are equally important.
Completely understand that. So are you saying that the inquiry could do well to look at what was the impact of those behaviours, or all those behaviours that you're talking about, on the outcome of the pandemic itself?
Absolutely. I think we know, for instance, that one of the simplest parameters which determines the spread of infection is the number of contacts people have. If people have twice as many contacts, they will spread the infection twice as much. So behavior is absolutely critical, and acting in ways which undermine people's adherence will spread the infection and will have consequences in terms of public health, in terms of lives, and in terms of deaths. So it is extremely important. I suppose the point that I'm trying to make is I would like there to be a broader focus on the behavioural science dimensions, and one central aspect of that behavioural science dimension has to do with, if you like, the social contract, the issue of trust, how trust was either nurtured or else undermined, because I think that's a key learning outcome for the future, how to create and maintain that sense of community, because there is a wealth of evidence by now that it's that sense of community, that sense of we rather than I, which is actually related to levels of adherence. And another aspect, which has already been alluded to, is the issue of communication. we've had a huge amount of emphasis recently on personal responsibility, on the I and what I want to do. Actually, in many ways, what we've begun to forget and lose is the sense of social responsibility and what's good for the community and the impact of my behaviors on others. So I think a lot of the communication, as well as a lot of the actions, have undermined that sense of community and undermined that sense of trust in government. And I think that needs to be a key dimension of the inquiry.
I can see exactly what you're saying, because one of the key levers the government has to try and slow down the infections is to change the behaviour of the public. And if they shoot themselves in the foot by not behaving well themselves, then they've done us all a disservice. Miriam, what's your view on this?
Yeah, interesting one. I think within the current draft terms of reference, the inquiry is going to focus on how decisions were made and then implemented. So I think there's an argument that leadership behaviours could fall under the implementation. However, it could be made much more explicit, as Stephen says, with a more explicit focus on behavioural science, which is absent from the terms of reference at the moment. So I think it could fall within the current draft scope, but it's not as evident as you might want it to be. The only other comment I feel I should make, really, having been in close contact with trust leaders and NHS leaders throughout the pandemic, is that each and every one of them seem to take very seriously their leadership responsibility in leading by example. And I think that sense of consistency from local leadership right through to the most senior individuals was very important throughout the pandemic and continues to be.
Thank you very much. And Rabinda, I imagine you have a very personal and emotional view on this subject. Over to you.
Yes, indeed, that would be right. I mean, in answer to the question, any rule breaking from the rule makers should definitely be included in the scope of the inquiry. So I guess the short answer to that is a resounding yes. While some government ministers broke their own restriction rules, I was having to tell my parents why they could not see any family members. I was having to tell my parents why they could not see them for several times a day, every day during 2020, as my parents struggled to understand the daily briefings content, referring back to the inaccessible government messaging, and as well as my dad's dementia was deteriorating as a result of not seeing the family. So we kept away. I'm one of 4 children of my parents, and we tried to do the right thing. Now, I know there has been talk about, if I'd known that the government would behave in this way, that there was Partygates going on, that I would have indeed broken the rules myself and seen members of the family and socialised and mixed. I personally have a different point of view on that. I think, referring back to, I guess, that social point, that this wasn't just about I miss my parents and my parents desperately missed their routine, especially important with my dad's dementia. This is bigger than that. So we as a family took the painful decision to abide by the rules, try to keep our parents safe, but also our community, both around me and my parents. We thought that was the right thing to do. And I guess just the final point I wanted to say on this is that people are still dying from COVID. The cases are on the rise again. Yesterday, the stats were 2,000 plus deaths in the last week based on the 7-day measure. A concern is that should restrictions, lockdowns need to be put in place by the government, to what extent would this be followed by the public who have lost confidence in them, particularly since the Partygate fines?
Thank you very much, Rabinda. I've got another quick question, which is again about speed and timing. We understand that the Met Police will not be issuing any more Partygate updates before the May local elections. Do you think that the inquiry should likewise fit in with the election cycle, or should this not be considered? I mean, I suspect that it would be quite handy for us to have the recommendations from this inquiry before we get hit by the next pandemic. But perhaps, Miriam, you'd like to go first on that.
Yeah, thank you. I think in our minds, the two most important considerations for the inquiry will be balancing getting that robust evidence base and reporting in a timely way when they have clear learning to share. So although I can understand the interest in reporting before an election or within a political cycle, for us, probably the two most important factors are making sure they put the time into appropriate time in, particularly to work with families to get the evidence that they need, and kind of balancing that against the need to report and share learning in a timely way. They would be the two factors we probably encourage them to look at the most.
Thank you. And Rabinda, any thoughts on that?
I think there needs to be complete transparency. I've just shared the stats from yesterday. We are still very much in the throes of the pandemic, and therefore transparency has never been so important throughout the inquiry. I don't see why this would need to fit around an election cycle. In my opinion, it makes it even more crucial to be better informed as the voter. Saving lives is the priority, not saving jobs. So electoral cycles shouldn't define the structure of the inquiry.
Yes, it does. It does feel like the can's being kicked down the road again. Stephen.
I must admit, I really do not understand the decision. I mean, the immediate decision from the Metropolitan Police. I mean, as an academic, if I do any research with people, I look for their consent, but that's got to be informed consent, because consent means nothing if I don't have information. Equally, democratic choices have got to be informed choices. How can I make choices about who I want to vote for if I don't know what they're like? And if some of the people I'm being asked to vote for have broken the law, seems to me it's part of democracy to know about it. So I don't understand this logic in general terms, and I completely agree with what the others have been saying about timeliness being an absolute criterion, as long as it is consistent with a robust process which is properly based on the evidence. So I do not see any rationale for delaying things around the electoral cycle. What comes out of this inquiry will give us some of the most important information we need to know and understand about government, and therefore make choices about who we want to be in government.
Thank you very much, Stephen. Back to you, Chair.
Thanks very much. Let me come now to Baroness Brinton.
Thank you very much. In your view, what steps would you like to see taken to ensure confidence in the inquiry's process and findings? And Rabinda, starting with you, is there anything in particular from other inquiries working with victims and those affected, a practice that you would particularly like to see?
I think the starting point has to be an agreed set of terms of reference, which are thorough and not made to be slimmed down. Making sure that the Prime Minister publishes the proposed terms of reference from the Chair will provide that vital transparency and help us make sure that the inquiry is asking those right questions. We are already at a delayed start. So what we must have is an understanding of, once this inquiry does actually start, which, you know, in the group's opinion should have happened a long time ago, many months ago, that it is going to be thorough and cover the terms of reference that it needs to. Yes, in terms of the inquiry asking those right questions, which it must if we are to provide those life-saving answers, and for each of those terms of reference topics to be thoroughly investigated. To see Baroness Hallett deliver on her 7 promises, and for the inquiry to remain a priority. So we are very much aware that we could be subject to other factors at play here, other factors that may bump down the priority list. We mustn't let that happen. It would be an injustice to all those people that have been lost over the last 2 years. They mustn't be forgotten, and this must remain at the forefront. And then finally, for there to be appropriate consequences to groups or individuals to be applied where necessary, as well as not just a list of lessons learned and then they are sort of stored away and forgotten about, but a very clear implementation plan as to how those lessons of learned are going to be addressed.
Thank you. Miriam.
Thank you. For us, we would be reassured by understanding that the inquiry was going to take into account the context within which the NHS entered the pandemic. So I think that's taking into account the benefits of having a national system, which meant that we could pivot the response to COVID relatively swiftly. We benefited from mutual aid between providers, between trusts, and we pivoted quite quickly to focusing on COVID within the hospital sector as initially asked. So some benefits there, but also some of the underlying challenges that I talked about in my opening. So the sense of underinvestment in the decade sort of leading up to the pandemic, questions about capital investment and estate, staff terms and conditions, vacancies, so the conditions within which we ask people to work within the NHS and care sector, and the kind of general sense of frailty, vulnerability around social care, all of those kind of contextual issues. We have also asked for a couple of points of clarification. So the terms of reference are really clear that the inquiry is going to look at decision making, and we're quite keen that that's applied within the NHS as well. So we understand what decisions were within the gift of government, what decisions were then within the gift of national NHS bodies, and then of local trusts and social care providers. So we're quite interested in that. I mentioned we're interested that the inquiry engages appropriately, I think, with the full range of service providers. So the focus on hospitals is really important, clearly, but I think mental health services played a role, and they were also impacted by the pandemic, as were community providers, our ambulance sector. So we're interested in some clarification as to how the inquiry is going to interact with the front line. Are they going to draw a lot of witnesses from the sector, or will they look at some outliers, or how will that work? We're quite interested that interaction is broad enough in terms of service type, but also, I guess, sufficiently targeted that not everybody is going to be called as a witness, I imagine. So we got some questions of clarification around that. And then the final key point I'd make, I think, is just coming back to this sense of interim findings which can be acted on, and potentially looking at some kind of mechanism by which to hold decision makers to account for implementing the recommendations that the inquiry does come up with, both at the interim stages and in terms of any final report.
Thank you very much. And Stephen.
I suppose I'd answer in terms of 3 T's, which are transparency, timeliness, and traction. Right at the beginning of the pandemic, remember when SAGE was formed, the membership of SAGE was not publicly available, the papers from SAGE were not publicly available, and the minutes of SAGE were not publicly available. All that changed, and I think that was very important in terms of people understanding the scientific basis of recommendations, and then hopefully the scientific basis of decisions which either went along or didn't go along with that information. I think we need to learn from that, and I think complete transparency is absolutely critical for trust, and transparency in all respects. The second is timeliness, that this mustn't drag on and on, but timeliness also in the way in which information is made available. It shouldn't be delayed, it should be made publicly available as soon as possible. And traction, something's got to happen. There is no doubt that we have done badly as a country, whether measured by deaths, whether measured by the economy in terms of the impact on GDP. Something has gone wrong, and something has got to change. And if we have a long and extended debate, but nobody can put their finger on what's changed, then I think things will lose credibility. So it's not only important, I think, to have interim reports. I think we need interim reports on what has been done to address the issues raised in those reports. If people can't answer that simple question, what has changed and how are we going to do things better in the future, then I think we will lose public confidence.
Thank you very much. Back to Barbara.
Well, thanks very much. And that brings us in a very timely way to the end of the first panel session. And let me thank you all, Rabinda, Stephen and Miriam, for helping us open up this important inquiry into the COVID inquiry. Thanks for your contributions. And of course, as always, you're very welcome to stay, but we know you're busy people, so you may have other things you want to do as well. Thank you.
Thank you.
Thank you.
So let me welcome our witnesses for the second panel and introduce them. We have Elkan Abrahamson. Elkan is Director and Head of Major Inquests and Inquiries at Brodie Jackson Cantor and is the solicitor representing the campaign group Bereaved Families for Justice. Margaret Aldred was the Secretary of the RAC inquiry from 2009 to 2016, which was chaired by Sir John Chilcott. And Sir Jeff Mulgan. Jeff is Professor of Collective Intelligence, Public Policy and Social Innovation at the University College of London. Thank you all for joining us. So let me open this second panel session by asking you if you can tell us a couple of points really. I can roll two questions together. Should this inquiry have started sooner? And given that the length of the inquiry is a crucial issue, how can the inquiry balance the need for timely reporting with the need to ensure public trust in the inquiry process? So can I come to you first, Jeff Mulgan?
Well, in a way, this is the central question is what can be done over what time scale? And I would pose the question slightly differently. The COVID pandemic has been an enormous experience, not just in terms of physical health, mortality, but also for almost every sector of the economy, of schools, the care sector, and so on. And I cannot see any way that a single inquiry can get into the crucial lessons to be learned about what happened, who is to blame, what needs to be done differently across so many sectors in a short space of time. And that's why we have recommended, my colleagues at the International Public Policy Observatory, that actually the only plausible approach to this inquiry is to divide it up into a number of related inquiries, some of which could be done quite quickly. If the core question is decision-making at the centre of government, that might be doable with an interim report by the end of this year and a final report next year, which I think satisfies that desire for urgency. But that will in no way address many of the things talked about in the last session, like what are the lessons for NHS? How could the whole care system do better in the future? What actually was the balance of costs and benefits for children or in terms of mental health and so on and so forth. And I think it'd be terrible if the inquiry ignored all of those things and only focused on what happened in number 10 in the Cabinet Office. So as I say, the prior question is what shape should the inquiry take overall, or the inquiries, and then what is a plausible sequencing in order to get some results. And even a genius, even a committee of geniuses could not deal with all of those issues within a year or two.
Okay, thank you. And Elkan, can I come to you next?
Good afternoon, and thank you for the invitation. The first part of the question was, should the process have started earlier? And I would say absolutely, for the reasons that you've already been given. And I would point out that, in a sense, the process still hasn't started because the inquiry is still not formally been set up. We have rather...
Elkan, we're losing your
situation of an inquiry chair who was appointed over 3 months ago, who doesn't actually have... Apologies. I'll turn the video off and see if that helps. Can you hear me better now? Yeah, I'll try again. I was saying we have an inquiry chair, but as yet, because the Prime Minister has not set up the inquiry, we don't actually have a formal inquiry yet, which is, it's certainly unusual to happen 3 months on into the process. So that's the first problem. And until the inquiry is formally set up, there's no duty to preserve documents, there's no duty to cooperate, because there's no formal inquiry to cooperate with. That, to me as a lawyer, is of enormous concern, because I'm sure information and documentation is already going missing. The second point looks at the length of the inquiry and the need for timely reporting. I would differ from Mr. Mulgan in the sense that I think it would be very difficult to have a series of parallel inquiries purely because they all interlock so much. All the issues overlay and interlock, and it will be very hard to distinguish them. So as has been envisaged, I would agree with the sense that one inquiry needs to be established as soon as possible. But I would also agree that there should be a series of interim reports. And I would suggest the first one looks at preparedness and possibly the system of decision making. Those are both items which could perhaps be looked at in isolation, and for which there is already a massive documentation which has been available over the years. The big issue, which I'll probably return to later, is openness. And again, that's been mentioned before. But can I just give a few examples of this? One is that the chair has made 7 promises to the bereaved families during the consultation process. Ironically, those promises have not been put on the website yet, which perhaps gives an indication as to the openness. We have been given, and we share, a draft of the terms of reference, which has been discussed. What we have not been given is the original proposed terms of reference and the comments that came back from the Prime Minister. We are not going to be given the amended terms of reference which go to the Prime Minister for his final decision. So we're already not part of the process of fixing the terms of reference, except, if you like, as supplicants. We're saying what we want to be included, but we won't know what the chair is proposing and what the Prime Minister is rejecting. And without knowing that, we can't argue as to why certain points should remain in, and we can't understand why they've been excluded. So already the openness that we'd hoped for from the inquiry seems to be ebbing away, and that's a real concern to me. Interim reports, monitoring and enforcement. One real problem with the inquiry process is that there's no enforcement mechanism or monitoring mechanism for the reports. And we see time and again that reports are made, but no monitoring as to their implementation. Inquest has been calling for years for a form of monitoring the implementation. Many inquiry chairs support this as well. And in Grenfell and the Manchester Arena inquiry, both of which are ongoing, interim reports have been issued. And that allows the chair of the inquiry to monitor the implementation of those reports, as has been suggested. One problem with the inquiry process is that once it concludes, the inquiry chair issues a final report to the minister, and the inquiry then stops. And it seems to me a simple idea to say, you know what, the inquiry chair can issue his final report, his or her final report, but can also say, and I'd like to come back in 12 months to see what's happening, please. Very simple solution, which would ensure that there's a degree of monitoring. It would require a law change. I think those are the issues I would address in answer to your questions at this stage. Thank you.
Thank you very much. Thank you. Let me come now to Margaret Aldred. And Margaret, there's a further, we've heard about terms of reference there and the issues around not being involved in that, just the bereaved families just being supplicants. In addition to your thoughts about when the inquiry should have started and the need for reporting to keep public trust, were the terms of reference of the Iraq inquiry negotiated? So that last point that Elkan was making there around terms of reference, how did that proceed in the Iraq inquiry?
I think that answering the question about should the inquiry started sooner, I think I don't want to give my personal views on that, because I don't think that's why I'm here. But I would say, in regard to the preservation of evidence, that it would have been open to the Cabinet Secretary to instruct government departments to preserve all relevant records. And the question, I think, which Baroness Hallett might be asking is whether or not that has been done, because it has been obvious for some time that there would be a public inquiry, so that such an instruction could have been issued quite a long time ago. So I think that's, and I would have thought that government departments could have spent some time and effort, recognising that they've been very busy on the pandemic, into collecting information which could be of relevance to the inquiry. So I think that's one of my comments. I think in terms of the Iraq inquiry terms of reference, they were very broad. We were simply invited to look at the preparations, the invasion, and what happened afterwards. And they were so broad that there wasn't really a need to have a debate about the detail of them, because that was left to the discretion of the chair. I think the one thing that was open to consultation, and which is relevant to preserving public trust, was that the original announcement envisaged that the inquiry would be like the Franks inquiry into the Argentinian invasion of the Falkland Islands, and would be held in private. And it was obvious very quickly that that would not command public confidence. And Sir John Chilcot spoke to various people and then proposed to the Prime Minister that he intended to conduct the inquiry in as open and transparent a way as possible. And that was one of the precepts which we thought was extremely important in retaining public confidence in the inquiry's affairs. The last point I wanted to make is on the comment that the chair will receive the terms of reference for this inquiry from the Prime Minister. I think it is interesting that the chair of the Grenfell inquiry wrote to the Prime Minister about the proposed terms of reference after the consultation period, and the Prime Minister wrote back accepting the proposals. And I don't know whether or not that option is open to Baroness Hallett or not.
Thank you. Well, let me come to my colleagues now to ask questions. And firstly, if I ask Susan, Baroness Mashmashy, ask the next question.
This is first of all to Margaret. How many work streams did you have, and did they report at different times? Should the COVID inquiry be set up in a similar way, or would you suggest something else? First of all, Margaret.
We did have a very large number of work streams. We started off with what we call building blocks, which was our attempt to eat the elephant of the extremely broad terms of reference that we had, which I would also say were by no means as broad as the coronavirus inquiry has. And they eventually turned into the 18 sections of the report, although the report had, some sections were quite bounded, other sections were very broad and had a number of building blocks in them. I think that the only way that the coronavirus inquiry can tackle its remit is to have building blocks. I think what will be key is establishing what happened, which is absolutely fundamental to making robust recommendations, but then also identifying what the key thematic issues are and how they relate to the organisations involved, and understanding the interrelationships between them, and what are discrete issues which can be handled separately, and what needs to be considered in the round. Because I think that that is something which, for the Iraq inquiry, was a major challenge in terms of how, who knew what when, how decisions were made, how they fitted together, were very important. I think the other issue which the coronavirus inquiry raises for me is the nature of the team which will be available to support Baroness Hallett, and whether or not she's going to have any panel or committee members who will be sharing the workload, and the extent to which she wants to appoint expert advisors to help her, and if there is a panel or committee, them, to assess the evidence that they were given. I mean, we had an expert advisor on military issues, a former Chief of the General Staff, Sir Roger Wheeler, and an advisor on international law, Dame Rosalind Higgins, who were extremely important in helping the committee assess what they were told, but they weren't giving evidence to the committee themselves. They were part of the process. I don't know whether that answers the question.
Do you think it's going to be difficult collecting the information?
It depends on which aspect of the inquiry, because it is so vast and it covers so many different organisations. And it brings me to a point which I think is relevant. The Iraq inquiry was a very particular sort of inquiry. It wasn't a statutory inquiry under the Inquiries Act. It was a Privy Council inquiry. And we were looking at the actions of government rather than non-governmental organisations. And because we were a Privy Council inquiry, we had access to documents, unfettered access to documents, but they remained the property of the government. And our issue was negotiating the disclosure of what was in those documents, particularly where they were documents which would not normally be put into the public domain. But the committee had those documents, and they were the bedrock of our analysis and our questioning of witnesses, because the contemporaneous record was the most reliable of the issues. And I think that's where it comes back to, you know, has the government actually put in hand arrangements to collect that and make sure it can be made readily available to the committee, to the inquiry. I think that other organisations have different issues, and I think because it's a statutory inquiry, once the inquiry has evidence, then it can disclose it as it wants, but the debate will be about what evidence is it given. And I think one of our really important things, which I think applies at least to the elements of the inquiry which are looking at the actions of government, is that individuals give evidence on the basis of their personal knowledge, experience and recollection. And what was very clear in the Iraq context was that many of the witnesses had a very partial knowledge and understanding of what had occurred, whereas the inquiry had the benefit of a written record which showed that some people knew some things and some people knew others. And I think there was a very telling piece of evidence from one of Jack Straw's special advisors, who said to the committee in one of the evidence sessions, "We thought we knew what was going on. I have realised since the inquiry has been holding its hearings that we didn't know everything that was going on." So I think that's quite important.
Thank you.
Thank you very much.
Thanks, Susan. That question was just to Margaret Aldred. So
yeah.
If I'll move
well,
on.
thank you, Margaret.
Thank you. Can I come to you next, Sal, Baroness Brenton?
Thank you very much indeed. Margaret, you've just started referring, and indeed Elkin did as well, about the concerns about the availability of documents. We have a particular interest, amongst other things, in contracts. What tools are available for the inquiry to force disclosure of documents, and a very specific question. The terms of reference at the moment are very light on holding ministers and their senior officials inside various departments to account for their decisions. It seems to be very much focused on the NHS and other bodies and how people worked. How do we ensure, how can we ensure that that will be the case, that they will be included, and the breadth of that, including things like setting up the VIP lane, mixed messaging, as we heard in the previous session, and ministers taking vaccine supplies from COVAX for which was supposed to go elsewhere in the world. How do we make that happen if the Prime Minister has a final sign-off on the terms of reference? Can I start with Margaret on that?
I think the terms of reference allow the inquiry to look at the procurement systems, and it will be up to the chair to decide where the evidence takes her. I think that there are issues about commercial confidentiality of individual contracts, but I think that the system is not in any sense commercially confidential. So so I think that the inquiry would not butt up against the commercial confidentiality if it's looking at the system. I think if it wants to examine individual contracts, then there will need to be a negotiation about where the public interest lies. I think one of the points which were relevant for us is that we had a written protocol with the government, which we agreed in the early autumn of 2009, about which issues were sensitive and what the sort of, as it were, dispute resolution mechanism was for having a dialogue about what could and couldn't be disclosed. I think this inquiry starts one stage back from that, possibly, in that they've actually got to agree what information is going to be given to them, because once it's theirs, they can use it as they want. So the argument takes place at an earlier stage in the process, but I think having a protocol, which is a formal one, about how disputes are to be addressed would be quite an important mechanism for the committee.
Thank you. Elkan.
I'll stop the video again, if you don't mind. So there is a mechanism under the Inquiry Act, similar to mechanisms in other court proceedings, to compel the attendance of people to give evidence and to compel the production of documents. That mechanism is subject to some exceptions: public interest, immunity, and damage to the economy. It's possible that some exceptions will be invoked by government, and that's where the protocol might come in. There is a second strand to this, which a name can sit in private. So, for instance, in a Manchester private, looking at the workings of MI5. So the information was made available to the inquiry, bereaved. I obviously, speaking from the standpoint of the bereaved, would prefer a fully open and transparent process, but one has to recognise that there may be justification for limits on that.
Thank you very much. And
yeah, could I add one other point?
Yes, sorry.
I'm sorry, could I just add one quick point, which again runs through this process of openness, and it's the duty of candour. We tried to get a law passed a few parliaments ago imposing a duty of candour on public officials and people acting in a public capacity, which was basically just a duty to tell the truth and be cooperative with inquiries. Inquiries would take considerably less time if the participants from day one were honest as to their failings and were open to the inquiry into their failings and genuinely wanted to learn, as opposed to what unfortunately tends to happen, which is public bodies looking as to how they can cover their own backs and blame someone else for what went wrong. And that requires a change in culture, which ideally, or not ideally, which could be led by statute, but ideally could be led by, as a society and as large organisations, are appreciating the benefits of being more open and honest.
Thank you. That's a really important point. If I could just ask you a supplementary, and then I'll come on to Sir Jeff. So do you believe that that duty of candour with a corresponding agreement to be safe from prosecution has worked under the Grenfell inquiry so far? Because obviously the Grenfell families have felt very concerned about that, but on the other hand, an enormous amount has come out. So is that the sort of thing you're talking about?
I'm not sure it has worked in the Grenfell inquiry, because you're right, an awful lot has come out, but it hasn't come out in the spirit of people volunteering their failings. For the most part, it depends on different participants, but for the most part, most participants did not, in their initial position statement, say, we think this is where we went wrong and we're throwing up our hands to it. It required the forensic process of the inquiry to expose those failings. And my point is that shouldn't be necessary.
Thank you very much. Sir Jeff.
Well, I think you've hit on a real dilemma or challenge for the inquiry. There is a model of inquiry which is investigative, inquisitorial, seeking to get to essentially hidden knowledge about things like procurement patterns or key decisions made in the heart of government. And not surprisingly, that creates a defensive reaction. And there's already a lot of anecdotal evidence of people for the last 6 months, distorting, I think, the records to protect themselves from that kind of inquisition. My sense is, though, with this inquiry, although that there will be an essential part of it, the majority of what we need to learn about the pandemic is not like that, is actually public, open information which needs interpretation in new ways. As far as I'm aware, every past inquiry in the UK has been focused just on a UK phenomenon, including when the Iraq War was global, but the remit was decisions in the UK. The pandemic affected every country. For the first time, we've had a totally global phenomenon, which means that every country is going through exactly the same kind of questioning of what happened, who was to blame, did we get the right decisions made on lockdowns or easings, and so on. And so it'd be very strange to do this as if the UK was a bubble. And that requires, I think, a different approach to evidence. So it's partly getting the best available data on what actually happened in terms of excess mortality, harm to economy, harm to mental health, where the most recent data from the Lancet is quite surprising, didn't really fit anyone's mental model of what had happened. And then it requires, in some ways, what's more normal in the academic world, the sifting and synthesis of evidence, again, about things like loneliness, isolation, all the other less obvious harms associated with the pandemic. None of which requires sort of getting into an inquisitorial approach to decision making within the system. And so I hope this inquiry, unlike, as far as I'm aware, any past inquiry, will use those different methods. And one additional reason for that, as was said, is you just rely on witnesses giving verbal accounts as we're giving. They tend to be very distorted. There's a huge amount of evidence now on the weakness of individual recollection. And that's why the more sophisticated ways of organizing evidence try to avoid being too biased by that and use lots of other systems. So I hope there will be a commissioning of synthetic evidence on all the different issues from care to mental health to the economy, skills, etc., which matter. Can I also just endorse what was said earlier by Elkin? It is a slight oddity of the British system that inquiries are set up by the executive. The executive essentially determines their terms of reference. They report into the executive, which is then responsible for implementation. And I think it's already clear that the legislation from whatever it is, 17 years ago now, isn't really fit for purpose for the kinds of inquiries we need on topics like COVID, which have to be more open, more inclusive, and have to include a capacity for follow-up, implementation, and monitoring. They can't just end on the last day of the inquiry. And it's really important that argument is made now, because otherwise we will be, it says, locked into a model which had in its mind a completely different kind of phenomenon to a pandemic like COVID. So the design challenge is, how do you both get that inquisitorial digging into errors, mistakes, harms made, while also ensuring this is a learning process really for the whole of our society. And perhaps one just final point, 20 years ago, I had to oversee the reshaping of UK government's management of risk and preparedness and resilience. We did that in response to a series of crises on PSE, fuel strikes, and so on. But that was an internal to government process, but did involve a lot of learning from other countries and companies and so on, and was all done in a fairly transparent, open way. I hope there is some internal government process happening in parallel with the external inquiry, though so far there's no signs of it at all. So I think a good question to ask is, how is the civil service, perhaps in a faster timeline than the external inquiry, ensuring it is learning from its own mistakes, putting in place better ways of scanning for risk, putting in place mitigation, preparedness exercises, and so on. And that whole model of risk management from the early 2000s actually worked relatively well for 10 or 15 years, and then that clearly atrophied in the last decade for all sorts of reasons which probably don't need rehearsing here.
Thank you, that's very helpful. Back to you, Barbara.
Thanks, Al. And can I go over to Paul now, Lord Strasburger?
Thank you, Chair. There's already been a number of reports by public bodies into COVID. Public Health England come to mind, the Crown Prosecution Service, NHS Digital. Do you think the COVID inquiry should absorb those and take those into account? And do you think it would be helpful? Would you like to go first, Jeff? Sir Jeff, I should say.
Whatever. Well, we will have lots of inquiries, whatever happens. And I think one of the design tasks for an inquiry of this kind is how to mobilize lots of kinds of evidence, some of which will be given to other inquiries, some of which will be done by academic exercises. And we've argued that needs to be organized as a platform, using basic modern digital technologies, not through the traditions of oral and written evidence given into an inquiry designed as a 19th century courtroom, and then use all of that to see the interconnections between different issues. As was said earlier, everything is connected, but there are, in addition, some rather different lessons to be learned in terms of school handling of pandemics, decisions in hospitals, handling of safety in care homes. And that's why I think it's vital that there are, it's already a matrix structure with in-depth investigations and inquiries on the more sectoral issues, but an orchestration of that evidence in a way that makes it very easy to search and find the connections and so on. So they're not all done in entirely separate silos and hard to connect together. Now, this is quite different, I think. Well, there's probably a little bit of a parallel with the Iraq inquiry, but I think it's a different kind of task to one we've ever faced before. So it needs a bit of creativity and innovation in how really the knowledge is managed. And in addition, as I said, how in real time we learn from the dozens of other inquiries which are happening around the world. And we are sort of monitoring them in UCL and IPPO in real time. So we don't just duplicate unnecessarily duplicate work which has been done elsewhere.
Thank you. That reference to the Iraq inquiry takes us very neatly to Margaret.
I think that the inquiry should look at anything and everything which is going to inform its conclusions and recommendations. And I think Jeff very rightly draws attention to the challenges which this particular set of issues are going to raise in terms of organising and accessing information. I mean, we had what we thought was a huge amount of information because we had, I think, 150,000 government documents plus all the open reporting and Parliament and everything. And I think it is a huge challenge to think about how you pull that together. And I think assembling information in a way that can be accessed and searched and used requires a very significant effort. Where that effort would be and whether the inquiry will have it is a question I don't know the answer to.
Thank you very much. Elkin.
Thank you. I absolutely agree that information management is going to be one of the main challenges for the inquiry. We learned a lot from Hillsborough, which had over 1 million documents, as to how this can best be managed. And there are software systems which can be helpful, and I'm sure the inquiry will be looking at those. As to, I think there was a separate question raised, which was existing reports, wasn't it?
Yes.
Absolutely, we should look at existing reports. The inquiry should take them into account, but it should be careful not to be bound by them, because there is the risk that a report reaches certain conclusions without having gone through a properly strict and robust process to have done so. So we have to be careful when looking at conclusions, but absolutely they're a great benefit in saving time, frankly, saving time of witnesses, saving time of exploring documentation, because they will have summarised those documents.
Thank you very much, and back to you, Chair.
Thanks. And over to Susan for her question on lessons learned.
How do we ensure that lessons are learned? Should it be followed up by a select committee to ensure the implementation of inquiry recommendations? Could we have Jeff, please?
there certainly needs to be some mechanism. It could be a continuation of the inquiry itself, but in a slightly different form, to come together periodically to review implementation and results, or it could be passed sort of into Parliament or the system. The key is that it's part of someone's job. They have an authority, and ideally there is a rhythm of reporting so that the public, can make sure actions are taken. My guess again, though, is that the recommendations of such a broad inquiry will be so broad in nature that some of that will have to be an aggregation of many, many different things being done within different systems, within the NHS in relation to mental health, or local government, or national government, or big employers, and so on. And this is again where I think we need some creativity in thinking through how to handle that breadth, not only of information inputs, as Elkin said, but also in monitoring very different kinds of implementation. And just to give one example, which I think is going to become a very prominent issue in the next year or so. Obviously, the pandemic was primarily about physical health, about infection and death and risk. We know that all over the world, there were huge mental health effects. And yet that was never really being reported on in real time. It wasn't a focus of the chief scientist, the chief medical officer. They hardly talked about it at all. Our mental health policies and machineries are far, far weaker than our capacities in hospitals, dealing with physical ill health. And in many countries, the pandemic will prompt actually quite a big shift to taking mental health much more seriously in public policy and in the implementation of health services. Now, that's a big strategic question, which I hope will be taken seriously in the inquiry. But weirdly, it will be an absence rather than a presence, because it won't have been talked about that much in the decision-making in Number 10 or the Treasury or the other places which will come out. And this is, again, where that sort of both reporting and then monitoring process, for that to be rigorous, robust, and energetic, is so important.
How long do you think the whole thing is going to take?
Well, I hope it's quicker than the Bloody Sunday inquiry, but I suspect in reality, again, I think we need a parallel series of inquiries, because otherwise it literally will take 20 or 30 years. And even with parallel inquiries, I think we're probably talking about 3 or 4 years at least. But ideally, within each sector, there can be interim conclusions, there can be steps taken. You don't have to wait for the end of an inquiry. And indeed, one lesson about how systems learn is the written report at the end of an inquiry is not an efficient way to make a system like a health system or a school learn well. Is actually involving the practitioners, the professionals in a dialogue, in understanding and so on, not in the very confrontational model of a courtroom. That's key to actually embedding lasting lessons. So as I say, if we expect nothing to happen, no lessons to be learned until a big fat report appears in 4, 6, 8 years' time, that would be almost the wrong way to think about it.
Thank you very much. It is a huge undertaking. Could we have Elkan, please?
Thank you. I don't think I can add anything to Jeff's answer, frankly, which was comprehensive and covered all the points I would have made.
Thank you very much. And Margaret?
I think the only points I would make in addition are it's the remit of an inquiry to identify the lessons. It's the responsibility of the government and the other responsible organisations to learn those lessons and think about how to implement them. And I think that given the range of different entities involved, the way in which the lessons of this inquiry are learnt and implemented will be very diverse. And I think that there is certainly a role for Parliament and select committees. And there might need to be some imaginative ways of structuring the select committees and how they work to make sure that they can look across boundaries where that is sensible in terms of the lessons. I think there will also be a range of other organisations, regulators, etc., who will have a role to play in holding delivery organisations to whether or not they have learned and are implementing the lessons. But I think that Jeff makes some very good points about the challenges and how we need to be creative. I think the only other observation I would make is that the inquiry process itself, the hearing of evidence and the lines of questioning, will help to draw out lessons. I only have one slight reservation, which is there is often a tendency with inquiries to say, well, that was, you know, what they're examining happened years ago. We've made lots of changes. Everything's fine now. In my experience, it very often isn't. And I think that that is something that you need to be watchful for.
Thank you very much. The epidemic is still going on, and people seem to have forgotten it in many areas, such as mask wearing. But thank you very much.
Thank you, Susan. Well, we're moving into our last couple of minutes, so let me just pose a final question, really. And it may be that we've already drawn out all the points you would want to make, but can I just ask you, each panel member, to tell us your key recommendation for Lady Hallett and the COVID-19 inquiry? That's a difficult thing to ask for one thing of all the things you've covered, but could you do that for us? Can I come to you first, Jeff?
Yes, well, as I said, I think she has to recommend a network of inquiries, not a single inquiry, otherwise it will fail. And that has to include, as Rabinder and others said in the earlier session, voicing the experience, the lived experience of people who've suffered the trauma worst. We haven't really covered that in this session. And then I think there's a division between some sort of big issues and some really quite technical questions, but which do need to be dealt with. For example, modelling was very important in the inquiry, modelling about the epidemic, economic modelling, but almost no modelling of things like mental health. We found as a country we had much worse central devolved local government coordination than other countries. This could be a way, a prompt for trying to resolve that. We discovered we don't have very good systems at the moment in government for synthesizing complex different things like balancing health, economy, community, and so on. So there's a whole series of subsets of question, which I hope the inquiry, if it doesn't deal with itself, can delegate to someone else to look at and make recommendations on.
Thank you. And Margaret?
I think I agree with a lot of what Jeff has just said. I think the key challenge for Baroness Hallett is balancing the resources that she has with the tasks that she has been given and thinking about whether or not, as it were, setting up other inquiries, which could be either under the overall auspices or if they are different, thinking about setting up other inquiries that can work in parallel. Because the inquiry will have a finite capacity and it has to bring that to bear in the most productive way it can. And I think given that once you start an inquiry, you have to follow the evidence and you don't know where that's going to take you, that's something that she will need constantly to bear in mind.
Okay, thank you. And to you, Elkan, the final word.
Thank you. Just on the separate inquiries point, we know that Scotland is having its own separate inquiry, but not Northern Ireland or Wales at the moment. And that itself creates an anomaly and quite serious difficulties, I think, for the chair in managing that. And it might be worth looking at that. But in terms of key asks, I think it all comes back to openness. Core participants should file open and honest position statements at the beginning, setting out what they accept they did wrong and what they didn't. Bereaved families should be allowed to question essential witnesses through their lawyers. The whole process should be as open as it can possibly be. And that's a way to achieve trust and confidence in the eventual findings and recommendations.
Thank you. Thank you all. Well, it's been a really fruitful and great evidence session that we've had today. It's really very timely for us to be looking at this. And so thank you all for joining us. And I'm sure we'll be coming back to this again and again, but thank you very much for your contributions today. And that's the end of our APPG meeting. Thank you.
Thank you.